Hi everyone, this is Dr. Oscar Marin. I'm a dentist in Southern California, and this time I'm bringing you the case of the week. I have chosen a case of one of my patients. She's a female in her late 50s. She has been coming to our West Covina office for about 6 years. This week she was evaluated by our hygienist, and she found several infected deep gum pockets scattered around the mouth. Now this patient has pretty decent oral hygiene, and that's one of the first things that seemed out of place, because traditionally gum disease has been associated with poor dental hygiene. But she has good oral hygiene and very little plaque or tartar buildup. However, she does have deep infected pockets, and it's my intention to help her not just by doing a cookie cutter approach with a deep cleaning, but to find out what might be the true source of her infection. When I started looking at her records, I found that in fact she did have a deep cleaning about 2.5 years ago, and since then her condition has not improved too much. She also reports grinding her teeth, and she stated that she wears a night guard every night, but recently she started experiencing frequent headaches. So I have a screening system that allows me to determine the patient's individual risk factors and take a peek into the patient's lifestyle for clues as to what could be the cause of the problem. Now, during our conversation, she reported struggling with gastric reflux. So now we know that she grinds her teeth, and teeth grinding affects the teeth and the gums, causing breakdown of teeth and the tissues that hold them. Also, she has gastric reflux, which is stomach acid backing up and bathing the teeth, dissolving the enamel and causing tooth erosion. But more than the separate conditions, the combination of reflux, teeth grinding, headaches, and gum problems paints a picture of a more serious problem that might be the missing link. It so happens that all these conditions point to a possible problem with sleep apnea, which is fragmented sleep when there's not enough air reaching your lungs. This is a very common and serious condition that puts your body in a high stress mode and triggers systems to try to keep you from dying while you sleep. Fortunately, sleep apnea is easy to diagnose through an at-home sleep study, but since the symptoms are not always that obvious, we have to keep a close eye for signs that might give us clues to a more serious medical issue like this one. So if you or any of your loved ones are struggling with gum disease that does not respond to traditional therapy, or teeth grinding and headaches, or if you know for a fact that you have fragmented, poor quality sleep, you may be suffering from sleep apnea, and we can do a quick screening in our office to determine if you're a good candidate for a sleep study. You can find out more about the causes of sleep apnea by listening to our podcast, Marin Dental Media, episode number 6, called Nothing But the Tooth. I hope this helps bring some light into issues that can have a negative impact on your health and helps you stay in good shape. Please share with your friends and loved ones, because you never know when information like this can change someone's life for the better. Thank you, and stay healthy.